Bismillahirrahmanirrahim. Assalamu alaikum everyone. I am Nida Hafeez. I am charge nurse at Rawalpindi Institute of Cardiology. I am privileged to have such an august gathering. I am going to have a brief session with you on a topic titled as Access Site Evaluation, Allen Test, US Guided Access, and Intra-Procedure Care. The objective of this study are to access site evaluation, to access site through ultrasound, to maintain intra-procedure care. Allen test. According to Doyle, a clinical test used to evaluate the patency of the arteries in a double arterial supply system, it can be used at the wrist to evaluate the radial and ulnar arteries. This picture speaks a lot. In first step of Allen test, ask the client or ask the patient to clench the fist, to make a tight fist like this, okay? When patient make a tight fist, operator occlude both arteries, radial and ulnar. It means when you occlude the arteries, you stop the blood circulation of the hand. In second step, you open up, your patient open the hand, which should show blanched hand, means the color of the hand becomes pale. In third step, operator release the pressure on the ulnar artery and observe the color of the hand for blushing. If the color of the hand returns within 3 to 5 seconds, it means that only ulnar artery is sufficient for the blood supply. In this case, you can puncture the artery. But if the color of the hand does not come back to original red, it means that in this case, you please can't puncture the radial artery. If your test is positive, your hand easily warms up and returns to its original color. This ensures that only one artery would be sufficient. If the test is negative, your hand is now cold. This means that one artery is insufficient to provide blood. Our next objective is ultrasonic guided access. Okay, what is the need of ultrasonic guided access? What do you think? Why we use ultrasound machine? Anybody tell me? क्या ज़रूरत है बाप के कहीं से जाके अल्ट्रासाउंड मशीन लाने की? हम कहते हैं वहीं पे प्रिक कर देते हैं, छोड़ो कौन जाके लेकर आएगा, ऐसा है? तो आपने क्या करना है? Ultrasonic guided access हम use कर रहे हैं is a technique that can increase safety as well as technical and procedural success when performing invasive cardiovascular procedures. Equipments are ultrasound machine, linear ultrasound probe, gel and 18-gauge needle. Mostly we perform ultrasonic access because you see that your patient is obese, there is vascular problem, or there is thrombosis or any other, disease, underlying cause of another is, then you use ultrasound machine. We discuss about intra-procedure care. Actually, this PPT is changed, which I have made. This is not that PPT, and that PPT is not open in this. So, okay, no problem. Intra-procedure care is the care we give during the procedure, or the care which we give to the patient during the procedure, overall the procedure, all the health professional teams must be active at that time during the procedure. The scrub nurse, preparation of supplies and equipments on the sterile field, carefully handle equipments, prime tubing, air-free while giving dye, and keep eye on vital monitoring. As a scrub nurse, as I am a scrub nurse in cath lab, so when I am giving care to the patient, I must keep these points in my mind, especially the priming of tubing, because it is very dangerous for the patient to give air bubble in the coronaries. As a circulating nurse, she identifies patient, she confirms baselines, she provides supplies, monitor vital signs and documentation. And thanks. Thank you so much for your patience.